So Stacey, how long have you been in practice now?
2.5 years now. I qualified in 2010.
Okay, are you enjoying it?
Love it. Absolutely love it. I
Okay.
love every part about doing acupuncture.
That's great. And it's your main form of income?
Yeah. I was doing a part-time job until 6 months ago,
Yeah.
and then stopped doing that, and have been able to spend some more time on the practice, and that's really made a difference as well.
That's great. So are you just working in one place? Are you working in a couple of different
No,
places?
I work in a couple of different places.
Yeah.
I work in a multi-bed clinic in Hackney, Islington way,
Yeah.
and then also up in North London doing more private patients
Okay.
from a couple of different places.
So how do you find the difference between that? Do you prefer one setting to the other? What are the kind of strengths and weaknesses of the single setting and the multi-bed setting?
Yeah, it's really interesting. The single setting, the strengths of that is I also combine massage as part of the treatment,
Yeah.
so it actually gives me a lot more flexibility, a lot more room to move in what I can actually cover in a treatment, and longer sessions, and so I build up a better rapport with some of the patients there, so I find that that's really good. But the multi-bed, I've got to see so many different people for a lot of different conditions. It's been a really good grounding and getting me up and running as a practitioner, because I started working there right from when I finished studying, right as soon as I qualified. So seeing such a variety, and the other great thing about that is that people get to come for the longer treatment, the course of treatment, whereas the private stuff because of the cost. So that's been really useful too.
And the kind of conditions you treat in a one-to-one setting and a multi-bed setting, are they the same or are they different?
Pretty much the same, actually.
And is there any particular area which you either specialise in or you see more of?
We see a lot of women for various things, so fertility, a few pregnancy actually starting to come up as well, and it's interesting, in the multi-bed sessions I'd see a lot more people for emotional things of anxiety and depression that I don't particularly see as much of that privately. It might be more they'll come in with something and that'll be a side thing, so that's interesting.
Yes, because people normally say that multi-beds kind of tend to be more musculoskeletal.
Not especially, no. I mean, we always get backs and knees and shoulders and those things,
but
I think that's the case. But still a good mix of other conditions in there as well.
Do you ever get fed up of having people coming and complaining about their various illnesses? How do you cope with that? How do you cope with being in a situation where people are always coming to you and are wanting things from you?
It's just, I guess, making sure that you've got that time to do other things outside of work, because I think that's a really important thing, because you can take it with you and constantly thinking about what they've said or what they're doing, so not just even while they're in the treatment room. So it's really making that distinct thing of trying to leave that or specify the time for it. I think I've still got a lot to learn on that case. I really do.
If you had any advice for someone who's studying acupuncture now, what would it be?
One of the things I would have liked to have done, now that I've been there and done that, is to get things ready for my patients. So things like with the lifestyle advice and some of the dietary tips that we give patients, when you're learning that, is a good time to actually write that up ready for your patient, because you're at that right level of learning it yourself and can explain it in a way that your patients will understand. You're learning it anyway, so you've got the time in some ways to do it. It's harder to go back on just trying to catch up on must do that, and it's not as much of a priority. That's what I'd do if I was still studying.
That's great, Stacey, thank you.